2 testing sites as of Saturday. City of Tampa opened up a testing site this week and plan to open another on Monday. And so there will be plenty of locations to be able to be tested. There are many opportunities to be able to be vaccinated. And that's why we are here today, is again to implore the community to go out and get vaccinated if you have not been vaccinated yet. From what the medical personnel that are behind me, what they will tell you today is that with this Delta variant, that if you have not been vaccinated, then you have around 100% chance of contracting COVID-19. So that's a pretty bold statement there, that you need to be vaccinated. You can still contract COVID-19 after vaccination, but the results are much less severe than they are in those that are unvaccinated. You can, as I said, vaccinations are readily available. You can be vaccinated all over the city of Tampa, all over Hillsborough County, all over the Tampa Bay area. The one place you cannot get a vaccination is once you arrive at the hospital emergency room with COVID-19. You cannot get a vaccination at that point. And it's a very sad commentary that medical personnel, both doctors and nurses, have to give that information to individuals that sometimes are dying as they're telling them that. So there's a simple solution here, and that's what we're asking everyone to please do your part for yourself personally, but for your family, your friends, and your community. It's imperative that we get vaccinated against COVID-19 and to stamp out the Delta variant. The less people vaccinated, the more opportunity there are for other variants. We have individuals here today representing government entities and showing how well our community works together on everyday issues, and specifically here, as we have from day one on COVID-19. We have Kevin Watler from the State Department of Health, and he is here representing them today. Dr. Holt could not be here. We also have representing Hillsborough County, Chief Dennis Jones, and we have from the city, Chief Barbara Tripp from Tampa Fire Rescue and Hillsborough Fire Rescue. We also have representatives from Advent Health, Baycare, Tampa General Hospital, and then we have some individuals that we want to share their story about COVID-19 and the reason that they have been vaccinated. So right now I would like to bring up an individual that I have known for quite some time, a really great person in my opinion, and he wants to share his thoughts about being vaccinated. Ray Wong.
Thank you very much. My name is Ray Wong. I'm an architect here in Tampa, Florida. Actually, I specialize in healthcare architecture. I'm the healthcare design market leader for Baker Barrios Architects right here in downtown Tampa. And I work with several of the facilities that are being represented today, Baycare, TGH, Advent Health, and I'm thrilled to be able to share my story with you all. I actually ran into the mayor just a couple of days ago, and I'm here representing really the everyday citizen. I ran into the mayor, and we got to trading stories a little bit about our battle with COVID. And I mentioned to her that as a healthcare architect and being in facilities all the time for the past 17 years and working with clinicians and doctors and executives, nothing really could have prepared me for what I went through battling COVID. My wife, myself, and my son, we all went through it. We've always prided ourselves in being very healthy, active. We work out quite often. We eat well. I think we do our best to rest well and deal with stress as best possible. And even still, I was incredibly sick. I think I've always prided myself in my professional career of having missed no more than 1 or 2 days being sick, but I was laid out for 21 days, which was incredibly difficult for me, obviously, but for my family as well. I wanted to just quickly share my thoughts on getting vaccination. So as part of the work that I do as a healthcare architect, it's actually a requirement for me to be vaccinated. And I wish I had been able to do that earlier and not had to deal with what I had to go through. I was fortunate enough that I needed to seek medical care at Tampa General Hospital. They have an amazing facility with amazing staff. And but even after 17 years in healthcare architecture, I really wasn't prepared for everything that I saw that day. And on any given day, I might see 3 to 4 ambulances in a hospital, and that day I think there was close to 12 ambulances. And I was discharged in the evening, and as I was looking out from the hospital across the Davis Island Bridge, there must have been 3 or 4 ambulances in the way in. So I know that for whatever reason this has become a hot button issue and very divisive and politically driven, but ending up in the hospital right now means that you're very likely going to end up on your own having care. I think we're all aware of the very restrictive visitation policies that hospitals have had to put in place. So for the average person, what that means is that if you were to end up in the hospital, you're going to be there by yourself while you're receiving care. If one of your loved ones ends up in the hospital, they're going to be there by themselves receiving care. And again, I just sort of want to end up by saying that you're likely not going to be as sick as I was, but that's not guaranteed. And if you can do your part to avoid getting sick as I was, as my family was, that would just be amazing. And if you can't do it for yourself, think of your loved ones, your family members, your kids, your spouse, your mother, your father. So thank you very much. I really appreciate the time.
Ray is part of the mayor's Hispanic Advisory Committee as well. Could you just implore in Spanish?
Yes. Muchas gracias. I am part of the Mayor's Hispanic Advisory Council. And for the Spanish-speaking folks out there, I'd just like to say, por favor, tómense el tiempo y averigüen sobre las vacunas. Vayan a sus doctores, vayan a los hospitales y pregunten qué deben hacer ustedes para recibir la vacuna. Y si necesitan más información, por favor, contacten al City of Tampa, contacten a sus doctores y por favor contacten también a los hospitales donde ustedes viven. Sí. Lo que estaba explicando recientemente fue mi experiencia estando enfermo con COVID. Y yo soy un arquitecto que se especializa en healthcare architecture y en 17 años nunca tuve yo que experienciar lo que tuve que pasar cuando yo estuve enfermo y es algo que yo no deseo para nadie. Y de vuelta quiero repetir que si pueden ustedes recibir la vacuna, por favor hagan el esfuerzo y traten de recibir la vacuna. Y si no lo hacen por ustedes mismos, por favor consideren hacerlo por otras personas, por sus padres, por sus hermanos, sus hermanas, sus hijos. Muchas gracias.
All right, thank you very much. And now to share very briefly his experience with COVID and as he recovered from it, what life has been like for the long haulers. Nick Hanson.
Thank you, Mayor, and thank you for using your office to bring awareness to this issue and for hopefully getting the message out to those who are unvaccinated or contemplating becoming vaccinated. I contracted COVID in December of 2020. Was 38 years old. At the time, I was running between 20 and 30 miles a week, working out 5 days a week. I'm a father of 5, so my lifestyle is pretty active. Always considered myself a very active and healthy person. And while my COVID illness was not pleasant, I thankfully did not have to be hospitalized. And it lasted for about a month of active COVID. And about mid-January, when I stopped shedding the virus and tested negative, my symptoms changed dramatically. And for the next 6.5, 7 months, I could only equate what I went through as hell on earth. You look at COVID today, and most of what we see is people who get somewhat sick or very sick, and then obviously those who die, unfortunately. But we don't talk about enough about those who, a sizable minority of those, 20 to 30%, we think, who are living with what's called post-COVID or long-haul syndrome, where you're dealing with the effects of COVID and for months, or even for some folks a year now after having COVID. And my symptoms were debilitating headaches, fatigue, memory loss. I was unable to get out of bed most days. Imagine trying to have a 5-minute conversation with your spouse or your children or your business partners and having to lie down for 2 to 3 hours just because that conversation on the phone took that much energy out of you. And it was through a lot of hard work, a lot of consultation with a lot of different medical providers, radically changing my diet that I'll never probably be able to get off, and supplements and things. I'm almost back to normal 8-9 months later. And what I would tell folks out there who are considering getting vaccinated, especially those who are young, is consider the costs to your family, to your livelihoods. If you are unable to get out of bed, or if you are suffering from long COVID for extended period of time, can you afford that? Can your family be there to support you? Because I can tell you that there are lots of folks who have long COVID who are far worse than I was. I consider myself very fortunate and very lucky that I was able to breathe most days, and that I was able to wake up. But there are a lot of folks who had no symptoms during their COVID, who then are now experiencing tremendously debilitating symptoms from long COVID. And there is no pill you can take. There is no amount of Tylenol or ibuprofen that will fix that. And I have counseled a lot of young folks in my demographic, the late 20s, 30s, young, healthy, fit, and tried to explain to them. And if I could do anything today, it would be to tell those people who are considering themselves to be healthy, which I think is great, and maybe somewhat impervious to the effects of COVID, I can tell you that that is just not accurate. Anybody can become susceptible to it, and anybody can suffer greatly no matter what your health conditions are. I have no pre-existing conditions. I went to the doctor every year. I consider myself pretty healthy. And if it can do that to me, it can do that to anybody. And I would just like to say to everyone considering it, to factor that into the risk. The risk is not just to get sick or to get very sick or potentially even die. The risk is also to live with something for the rest of your life that will impact how you function every day and how you interact with people around you every day for the rest of your life. And so as you consider yourself looking at your options and contemplating vaccination, if I had had access to the vaccine in 2020, I would have taken it. I knew I was going to take it before. And I can tell you that even if you've had COVID and you have contemplating getting vaccinated, get vaccinated. I got vaccinated after COVID, and it helped greatly reduce my symptoms, but I still live with it. And I know I'm protected. And so for those of you out there considering it, I just implore you to consider my story and to talk to others who've had COVID, because I will assure you that there are more than you realize are suffering right now with symptoms that are far worse than the illness itself when they were active, and they have had to change their lifestyles long term because of their COVID infection. So I want to thank again the mayor and for all the healthcare professionals and all the doctors who helped me. And I want to implore those out there who are watching today that there is no amount of being healthy that can protect you from the effects and ravages of COVID and long COVID.
Thank you, Nick. And next to the Chief Medical Officer from Baycare and a great friend, Dr. Anad, is going to come up and share why he had his family vaccinated, and then talk about the spike and how it is impacting healthcare workers at this point. Doctor?
Thank you, Mayor Castor, and thank you all for taking up this important topic. As a healthcare leader here in Tampa Bay, as an ER physician, and as a parent of 3 young kids who recently started school, I hate to tell you this, but the healthcare system is in crisis because of COVID. None of us want to hear this. We're all tired and we're all fatigued, but we have to accept that. Let me give you some proof points. In early January, we had about 100 patients with COVID admitted to our hospitals across Baycare. 100. Fast forward a month, we have 1,000 patients that have COVID right now across Baycare. 400 of them actually reside in Hillsborough County. That's a tenfold increase that we've seen. The majority of those patients that we're seeing are unvaccinated. We're seeing unvaccinated people end up on ventilators. We're seeing unvaccinated people pass away. There is definitely a protective benefit to the vaccination. The other thing we're seeing is that this is affecting younger people this time, people 19 to 64. These are not individuals that were infected last time, but these are younger people who were healthy, they had no symptoms, they have no chronic disease, and all of a sudden they're ending up on a ventilator and passing away. 19 to 64-year-olds. Now recently, we had to make a difficult decision at Baycare to suspend all elective surgery cases. You may wonder, what does that have to do with it? But we need to create extra bed capacity so we can take care of our patients and the community. And so we suspended elective surgery cases so that we have more beds. We can move those ventilators, not from those surgical cases, but move them over into the ICUs. Same thing with our nursing staff. Now, I'd like to tell you a little bit about our path forward. I really think we need to get vaccinated. I have 3 young kids, and my oldest son has been vaccinated. He's 13. My parents have been vaccinated. I've been vaccinated. I would highly recommend it. We're going to get through this, and we're going to get through it either with a lot of people getting sick, ending up in the hospital and passing away, or coming together with the proud Tampa Bay community and getting vaccinated. I started wearing a mask recently, and none of us like these masks. None of us want to wear these masks, but we're wearing it because I have 2 young kids at home. I'm not wearing it for myself, I'm wearing it for them because they're not eligible to be vaccinated. They're 11 and they're 8 years old. And so I continue to wear it for them. I got vaccinated for them. I get vaccinated for other people. So I would encourage you, just in closing, please think about it a little differently. It's not about us, it's about the community. It's about the loved ones. Heaven forbid, you think you're fine, you're young, you're going to recover from this. We heard about some of the long haul syndromes that you may have. But what if you bring it home to a parent, to a young kid who's 2 years old, to a baby, a newborn baby that just happened, and they suffer death, they're in the hospital, we could never live with ourselves. So please just get vaccinated. It's been proven safe. Hundreds of millions of people have been vaccinated. So thank you. Appreciate it.
What are questions at the end? Thanks, Doctor. Thank you so much, Dr. Anand. Much appreciated. And now we have the Chief Medical Officer from Advent Health, Dr. Doug Ross.
Good afternoon, and thank you, Mayor, for setting this up. And to my colleagues, hello. We are undergoing all the same and experiencing all the same in terms of surge. This is a surge like we have never seen in the past. We are seeing our numbers dramatically increase and continue to increase across our 6 hospitals in Tampa Bay area. And this is quite concerning for us. Our staff, nurses, doctors, lab technicians, respiratory therapists, all are working tirelessly, or I should say tiredly, to take care of more and more patients that are coming in. We're capable of doing it, but we thought we were going to get a break. We thought, to your point, with 100 patients in the hospital in January, that things were going to improve. And quite honestly, people were breathing a sigh of relief. And now that's not the case. We're fighting this virus once again with larger numbers than ever before. All of them, pretty much all of them, unvaccinated. And it is too late, Mayor, when they come to the emergency room or they're going to be intubated and put on a ventilator. It's too late when they ask to be vaccinated. And it tears at the heartstrings of all of our healthcare givers, really the health givers in our communities, to actually see stuff like that happen, because we know it can be prevented, and it can be prevented through vaccination. We are seeing children who are being hospitalized currently at our institution. These children can be very young, 18 months, 22 months. We see kids below 12. We've had people in their 20s die of this disease. And we wonder what we can do to protect our children. People under 12 cannot get vaccinated, not yet at least. And so in order to protect those children, parents need to be vaccinated. What good would it be if your child gets sick or you get sick and can't take care of your child because you're unvaccinated? We ask that anyone over 12 in the family get vaccinated, and I applaud you, Dr. Nan, for doing that, because it's so critical that as many people around the children be vaccinated. And then anyone 2 and over to 12 need to be masked. And we talk about at Advent Health sort of the 3 things you should do when you wake up. You should brush your teeth, brush your hair, and put on your mask, and off to school you go. So we strongly advocate immunization as a way out of this pandemic. But I will also speak about masks. Masking is a critical way we can slow the spread of this disease, much like a year ago, except, to the mayor's point, this is a much more contagious variant. And so masking protects not only yourself, but protects others if you're asymptomatic but still are infected with the virus. So we encourage people to wear masks, wash your hands frequently, maintain social distancing in order to slow the rate of speed of transmission of this disease. Otherwise, our health systems will be overwhelmed and we will not be able to care for patients who come in. I want to thank you again for the opportunity to speak.
Thank you, Doctor. Now we have the Chief Medical Officer from Tampa General Hospital, Dr. Peggy Duggan.
Thank you, Mayor Castor, and thanks all of you for being here today. Like my colleagues, Tampa General Hospital has seen a dramatic increase in patients coming in with COVID-19, and particularly the Delta variant. So we too were close to single digits of patients in the middle of July, and now about 20% of the hospital patients are admitted with COVID. It's a significant rise, and our teams, they're doing their jobs, right? They're coming to work. They're working very hard to protect you and all of the members of the Tampa Bay community. We're working to protect our colleagues and friends, and I'm asking you in Tampa Bay to do your part. Along with my colleagues behind me, I agree, most important thing is get vaccinated. And getting vaccinated protects everyone. Those who've had COVID, those who think their immune systems will fight COVID, again, this is not about our personal health, it's about each other. And it's important that we take that seriously today. And lastly, I agree with the masking as well. It's time for all of us to put our masks back on, to be seen with our masks on, to make that statement that we're here to protect each other. Right now, we're asking too much of our healthcare workers. And the thing that we can do as public citizens is make that difference. Really, put your mask on, get vaccinated for each other, and that will allow us to manage the patients we have who, over the next few weeks, will continue to progress. At Tampa General, we see many of our patients who are admitted to our Global Emerging Diseases Institute are also progressing to the ICU care and intubation. Many of those patients will not survive. We really need your help. We need your help to stop the spread and to help each other. And so I agree with my colleagues here from the health system and across the state to help us help you get better. So thank you very much for your time.
Thank you, Dr. Duggan. And now to round out, we want to bring up an expert to talk about the vaccine and the vaccine distribution. Dr. Vandala Wright from Health Matters Pharmacy. Doctor?
Hello, everyone. Thank you, Mayor, for allowing me to be a part of this conversation. I wanted to share some information today about our efforts at Health Matters Pharmacy on giving the COVID-19 vaccine and the difference that we've seen since the beginning of the year to now. I think everyone kind of got comfortable not wearing a mask and not getting vaccinated, and everyone was back outside in the beginning of the summer. Now I see everyone coming in to get vaccinations, and I do recommend that everyone who is eligible to get a vaccination, to get a vaccination. At my pharmacy in East Tampa, we have all 3 COVID-19 vaccinations available. For the ages of 12 and up, Pfizer vaccination is recommended. We also have Moderna and Johnson & Johnson. We have collaborated with community leaders, doctors, and the city of Tampa in our efforts to make sure that people are not left behind. Our community in the inner city lags on information, and we lag on access. We want to make sure that there is not any barriers. If you need us to come to your home and give your vaccination, we will. Ending this pandemic is something that we all want, and we know that we're going to do that through vaccinations. We don't know everything that's going on with the different variants, and everything is ever changing, but what we do know is that the vaccinations are helping. Thank you.
Thank you, Dr. Wright. Okay, before we open it up for questions, what we would like, the message that we are trying to get out today is that we are in a crisis once again with the spread of COVID-19. And the way out of this crisis is to get a vaccination. So I'm not asking you to listen to other voices in the community, to look at social media. Talk to your physician or talk to your pharmacist about the vaccines, getting vaccinated. It is critically, critically important. And the voices that you hear in the community, those individuals talking about not getting a vaccine, those voices are far outweighed by the individuals that have successfully gotten a vaccination, and they have been able to avoid being infected with COVID-19, or when they were infected by this Delta variant, it did not end up in a hospital admission or in serious effects from COVID-19. So please, please, please listen to the physicians, listen to the experts, and also listen to those individuals that have experienced this and understand the value of getting a vaccination. This could not be a more important issue than it is today. We need our entire community vaccinated. You owe it not only to yourself, but to your loved ones, your family, and your community. And now we can open it up to questions for any of the professionals. No, incentive individuals, we have called back our city team from remote working. Everyone came back on July 7th. And so before that, we covered any COVID-related illness. And so now individuals who are unvaccinated and contract COVID are basically have to take their own time and deal with COVID-19. So we are encouraging everyone. And clearly the incentive at City Hall, if you are vaccinated, you can voluntarily show your vaccination card, and you can wear a button or a bracelet that says you've been vaccinated, and that can keep you from having to wear a mask in certain locations. But we are back to encouraging masks in any public location. Well, I would defer to if any of the hospital professionals want to answer the question about the personnel issue, because I'm clearly not as familiar with it as they are. Dr. Anand?
Yeah, I think the question's a great question. I can't speak to Representative Castor, Congresswoman Castor, or DeSantis, but I can tell you the number one problems all of the hospitals are facing in this region, I think my colleagues would agree, is staffing. This is a time of the year when volumes aren't this high, and we are seeing record volumes in our hospitals. We have nurses, but they're working hard. They're working overtime, so we need clinical nurses, respiratory therapists, folks that can help us take care of this increasing number of COVID patients. So right now, staffing is our number one need right now. We can take care of the community, and we will, because our team is really hard working, but we need more. So there are staffing agencies that are out there. We have a really great group of nurses that work for us. I mean, I was really impressed. I was at our St. Joe's Hospital just a couple of days ago, and these nurses are working incredibly hard. They come in because they want to make a difference. They stay extra because they want to help a person out. If someone doesn't have a loved one, they stay a little bit longer. And that's the kind of people that we have, and we're very fortunate to have. Of course, we can always use a little bit more. Yeah, great question. On the pausing on elective, this is the last thing that we ever want to do. It's an inconvenience for all of us. Imagine if you're going in and you're supposed to get knee surgery, having to wait after you got mentally psyched up and ready for it. So we are very sorry to the community. But the reason we're doing this is because we need the bed capacity, we need the ventilators, we need all the supplies to be able to take care of this increasing COVID epidemic that we're having. I can't give you an exact time when we'll do it, but I can let you know and the community know as soon as we are able to, and we think the community is in a safe position, we will resume elective procedures. Thank you. I think for the entire community, those of you who have been vaccinated, thank you. For those of you who wear masks because you're trying to protect others, thank you. Those of you who think twice before going into a crowded location because you may infect others, thank you.
And the second question, as you probably are aware, I applauded the state and the governor's initial response to COVID-19 in allowing local jurisdictions to make the decision in the best interest of their community. And so that's something that I would support. The different locations, when you look at rural as opposed to metropolitan, the needs are completely different. And so we need to look to local leaders to have the ability, to have the power to make the decisions that are in the best interest of their residents. Well, I don't want to get into a back and forth. The governor makes decisions in the best interest of the state, and I'd like to be able to make decisions in the best interest of our community. Well, I would suggest, again, not being a medical professional, that individuals wear masks when they can't social distance, and then get your vaccination. That is the simplest way. And we may get to a point where you show that vaccination card in order to participate in any type of public events.
Mayor, would you suggest that people maybe stay home a little bit more right now rather than going out to restaurants and bars since we are seeing this spike, or any other recommendations other than the mask?
Right. Individuals need to make decisions that are in their best interest and in the best interest of their families. But the decision to get vaccinated is in the best interest of everyone. So that is the decision that I could not support more. All right. Thank you all very much. Yes. Right. We're always prepared. We have all of our policies, procedures. We work hand in hand with the state and with Hillsborough County emergency management directors, and we are monitoring that minute by minute, and we are prepared. We will keep the community involved and informed every step of the way. Right now, it doesn't look like it's going to be an impact, but any type of rain after we've been saturated could produce a flooding situation. So we are monitoring moment by moment, and we will keep our community informed. Thank you all very much.